Hey there, future nurses. Welcome back to NCLEX Practice Hub, where we help you ace your NCLEX exam with confidence. Today, we're diving into some essential tips to tackle those tricky NCLEX questions with phrases like the most important, priority, the best, and more. First things first, let's understand what these priority questions are all about. These questions are designed to test your critical thinking and decision-making skills. They often contain phrases like the most important, the priority, or the best. Your job is to identify the action that will make the most significant impact on the patient's well-being. Priority questions require you to think critically about patient care scenarios and decide which action will address the patient's most urgent needs. It's about knowing what to do first to ensure the best possible outcome for the patient. These types of questions can be a bit daunting, but with the right approach, you'll be able to navigate them like a pro. Tip number 1: understand Maslow's hierarchy of needs. This theory prioritizes human needs from the most basic physiological needs, like air and water, to higher-level needs like self-actualization. In NCLEX questions, physiological needs usually come first. For example, if a patient is having trouble breathing, that takes priority over pain or anxiety. Tip number 2: use the ABCs, airway, breathing, circulation. Always address issues related to the airway first. If a question involves a patient with a blocked airway, that's your priority. After that, focus on breathing and circulation. Tip number 3: apply the nursing process. Remember the steps: assessment, diagnosis, planning, implementation, and evaluation. Often, the most important action will be related to assessment or gathering more data before jumping to conclusions or interventions. Tip number 4: think safety first. If an answer choice involves ensuring patient safety, it's often the correct choice. For instance, if a question asks about the best action after a patient falls, ensuring the patient's safety by assessing for injuries and calling for help is the priority. Tip number 5: look for keywords. Words like first, initial, immediate, or most important are clues. They tell you that the answer should focus on what you do first or what's most crucial at that moment. Always read the question carefully and identify these keywords. Let's practice with a couple of sample questions. I'll read the question, and you can pause the video to think about your answer. Then, I'll explain the rationale. Example 1. A patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with shortness of breath. What is the priority intervention? A. Administering a bronchodilator. B. Checking oxygen saturation. C. Starting an IV line. D. Placing the patient in a high Fowler's position. To answer the question, let's follow these steps. Identify the problem. Read the question carefully and identify the main problem. What's the patient's immediate need? What's the most pressing issue? The immediate problem here is the patient's shortness of breath. Eliminate distractors. NCLEX questions often include distractors, options that are correct but not the priority. Eliminate these to narrow down your choices. Use clinical judgment. Apply your clinical knowledge and judgment. Think about what you would do first in a real-life scenario. Remember, sometimes the best action is to assess further before intervening. The correct answer is D. placing the patient in a high Fowler's position helps improve breathing by expanding the lung capacity. Always address breathing issues immediately. A postoperative patient is complaining of severe pain. What should the nurse do first? A. Administer pain medication. B. Assess the patient's pain level. C. Call the healthcare provider. D. Check the patient's vital signs. The correct answer is B. Always assess the patient's pain level first to determine the severity and appropriate intervention. Great job, everyone! Remember, the key to mastering priority questions is understanding the underlying principles and practicing regularly. If you found this video helpful, give it a thumbs up, subscribe to NCLEX Practice Hub, and hit the bell icon to get notified of our latest videos. Leave a comment below if you have any questions or topics you'd like us to cover next. Until next time, keep studying and stay confident. You've got this.